Welcome back to the Delaware Way. I'm Larry Menti. Robotics are slowly becoming more and more a part of our everyday lives, including our health care. To talk more about that is Dr. Chris Mitchell from Christiana Health System. He is the Director of Robotic Surgery at the Helen F. Graham Cancer Center and Research Center. Thank you so much for being here. I appreciate it, Doctor. When people hear about robots, they're scared anyway. They're a little bit nervous about robots being a part of our lives, especially when it comes to healthcare, I would think, especially when it comes to surgery. Allay some of those fears.
So I understand why people may be concerned when they hear robotics in surgery. But for us as physicians, importantly, robotics have opened a new frontier for surgery. So they're now allowing us to do surgeries through much smaller incisions, much more precisely, and the net result for the patient is improved outcomes. And when I meet with a patient and talk to them about robotic surgery, the first myth that I dispel is that the robot actually does anything on its own. So the robot's a tool directed by the surgeon's in control the entire time, but that tool allows us to do more precise work and improve outcomes for our patients.
I think one of the problems you have is, robots aren't what we saw in Lost in Space. Robots aren't what you see in Star Wars. Robots can be that big. Robots, the term robotics has nothing to do with someone replacing a human being.
No, absolutely. At this point in time, the surgeon is still in control of everything. And again, the robot's just facilitating us doing surgery through smaller incisions and more precisely.
And specifically, how do you use it?
So the way that it works currently is the robot that we use, the Da Vinci robot, has two components to it. One is the actual robotic arms, which are controlling instruments that are inserted into the patient. The second is the console that the surgeon sits at and looks through. So we're looking through a highly magnified, high-definition picture. So this improves what we're seeing. We can see things better than we can see with the naked eye. And through that console, we are commanding the instruments or the arms to move in certain motions to accomplish the surgery.
And right now, you're using it when it comes to prostate surgery?
So one of the most common things that I use it for is treating men diagnosed with prostate cancer. It's termed robotic prostatectomy. And now we're using the robot to do what was previously done through an 8 to 10-inch incision. Now we can do it with 6 half-inch incisions.
And are you going to be expanding the robotic use at the Christiana Care?
So since I arrived in 2015, we have continued to dramatically expand the uses for robotic surgery. So it's not just, I'm a urologist, we're not just using it in urology, we're using it across the entire healthcare system, including multiple other surgical fields.
Do patients even know when they go in that robotics are going to be used? Do you tell them that?
Yeah, so ahead of time, this is a discussion that we have with the patient, if they'd be a good candidate for robotic surgery, and then what the advantages of robotic surgery are. The patient has the choice whether to choose a standard operation versus a robotic surgery. Is
there fear? What's the percentage on that?
I think once you explain the details of the surgery to the patient, almost all would end up choosing robotic surgery for the simple reason that with an experienced surgeon at a high-volume center like Christiana, you can get better outcomes. You can get a faster recovery for the patient. They can spend half the time in the hospital. They're getting home to their loved ones much sooner. They're getting back to their jobs much sooner. So it's a win-win situation for everyone.
The success rate, so when you talk to the patients, you say you have a higher success rate with robotics than you do if you don't have robotics.
Yeah, for most surgeries it's superior, although in some applications we need to make sure it's at least comparable, and then it may have the other advantages of shorter recovery time. So for some cancer procedures, the cancer outcomes are the same whether it's done with a standard incision or whether it's done robotically, but from a patient perspective, they're back on their feet much sooner, and their healing time is much less. So we're doing the same quality cancer operation, and the patient's feeling much less after effects of surgery.
And this is new now, but I imagine this is going to be standard in years to come. You won't even have to have that discussion anymore.
Yeah, no, I mean, I think this is becoming more and more common to patients. They're more familiar with it. They're more accepting of it. And often patients are now seeking this out.
Wonderful. Doctor, thank you so much. I appreciate you being here. Dr. Chris Mitchell, Christiana Health Care System. He is the Director of Robotic Surgery at the Helen F. Graham Cancer Center and Research Center.